And welcome to the weekly dementia blog. We're doing it on Tuesday today because of the holiday weekend. I hope everyone had a wonderful Memorial Day and had a chance to spend time with your family and friends, but also took a moment to remember and recognize everyone who fought and died for us to make this all possible. So, a shout out to all the veterans. Thank you very, very much for what you do and what you've done. Is far more important than what certainly what I do. So I wanted to get in and get started. This is going to be a shorter blog, but it is something that has come through in terms of a lot of questions through Vanderbilt, also through the Maury County Health System, who send me a lot of referrals to their patients and a lot of questions and different lectures. Is with the pandemic and COVID-19, we have seen a dramatic impact on our dementia patients, but also on the caregivers. So let me elaborate on that just for a moment. As we begin to have the quarantine, we have social isolation, which is dramatic. It has a dramatic impact on our dementia patients, but also it has a dramatic impact on the caregivers because now they don't have any rest time. They don't have any time away to kind of get recharged. So I want to talk a little bit about that. I have seen and diagnosed pseudo dementia more so since February than I ever have. And we talked about pseudo dementia in previous blogs. Pseudo dementia is a type of dementia that is treatable, that is curable. However, it can get worse if we don't treat the depression. And that's the underlying etiology of pseudo dementia. So I had a patient just the other day that we have pseudo dementia, but then also we have a white matter dementia as well. So she has a form of dementia, but then she has pseudo dementia on top of it, which has gotten worse. So working with her PCP, we got her on an SSRI for the depressant, and she seemed like she's doing much better. So number one is I would definitely say we're seeing increased anxiety, we're seeing increased depression. So if you see your loved one or even your patient, if you're a clinical practitioner, you see your patients who have decreased attention all of a sudden, decreased engagement, changes in their sleep patterns, just overall signs of clinical depression and overall general anxiety, we can certainly be onsetting a pseudodementia, which can make everything worse. So making sure that we have a good handle on this and be able to identify the symptoms to see what kind of medication do we need to be put on to help with improving of the general anxiety disorder and also depression, as they do commonly accompany themselves. Even though that we are socially isolated, we're beginning to now reopen in many states. I would suggest, Dave, definitely having a structured schedule for your loved one, or putting this or implementing this with your patients, and also getting out. Even if it's outside and taking a walk once a day, or something to kind of get outside the home environment. Also, being as safe as possible, but also keeping it very structured. Also, maybe implementing some hobbies or something that the individual or the patient used to do before. I've had countless patients that we use to put different things in place that tapped into previous hobbies that would help decrease some of these symptoms that we see without having pharmacological intervention. Now, when it does come to pharmacological interventions, definitely, it of course it depends on the patient, so they need to be thoroughly assessed. But this is in general speaking. Maybe looking at the SSRI dosage, so your antidepressant dosages, and also maybe another anti-anxiety medication such as like Seroquel that could help with some of the anxiety and depression. Always stay away from your benzodiazepines like your Xanaxes, your Ativans, your Klonopin. Those medications are not good with patients with dementia. Also, I would say that I refer a lot to respite care. Respite care companies, again, I would call 2 to 3 of them to make sure that it has a right fit for you and your family, or for your patient themselves. If you'd like to contact me directly, I can definitely point you in the right direction and help you with that. But respite care, even if they come in once or twice a week, it's then going to help with a caregiver. I always say that I have two patients. I have the patient themselves, and then I have the caregiver. And so you have to keep that in mind too. As I've said before, we've seen emergency emergency room rates skyrocket due to caregivers. So caregivers are now going into the emergency room more so than the patients, and we're also seeing the patients outlive the caregiver, especially in late onset Alzheimer's disease. So, I would say that try to do as much as we can to take care of yourself, but also take care of the patients as we begin to reopen our country. And definitely, if there needs to be a pharmacological intervention, then we can certainly look at doing that as well without making the patient, quote unquote, kind of like a bobblehead. Okay, so there is a balance there. Next week, we're still filtering in more questions. So we do want to talk about symptom management. So that will be next on our list. So we'll hopefully get to that next week. Keep the questions coming in. We appreciate all the views. Again, these are being sponsored by SpectraMed, who is definitely, launching and getting into more of the dementia area. And we're excited about that because I know we're helping a lot of people with that. Again, my name is Dr. David Hutchings, and we will see you again next week. Thank you.